I definitely didn't take a traditional route. I started off in nursing, and when I was in my undergraduate studies, there was a nursing school starting at my school. My goal was to work with people and to work within the medical field. And so I ended up applying to the nursing school, and I was in the first class. So I ended up going for a master's in public health. And while I was in my public health degree, I decided that I really wanted to join the Navy. So I was actually in healthcare finance, not doing any nursing. And I found myself at the end of the 5 years kind of thinking, is this really what I want to do for the rest of my life?
Welcome to A Nurse First. This is Imelda Reyes, telling her own A Nurse First story.
And so I had talked to my commanding officer about getting out of the Navy, and he just thought I was making the wrong decision. So he gave me a reflective project and told me to really look back at my favorite job and really help me determine where I wanted to go. And my favorite job was my job after nursing school, where I worked with Migrant Health Center. We had migrants that came from Texas up to Michigan. This migrant center provided the health care for the people that in the summer that would come up to pick cucumbers and stuff like that. And so I was responsible for 9 camps. So in Southwest Michigan, there were all these migrant camps where people lived, and they had one person, they were camp health aides that were kind of responsible for the camp. And I was responsible for the camp health aides and then the overall health of all of the camps. I had an opportunity to do a lot of outreach, and we would make sure kids were up to date with their immunizations, women were getting their OB care, anything that happened within the camps we took care of. And I realized that nursing was really where I needed to be. So I went back and got my nurse practitioner degree and started working at Children's Healthcare of Atlanta, where I was a pediatric nurse practitioner, and I loved it. And then I started precepting students, and I realized that I really liked teaching. When I got my first student, I was super scared because I thought I didn't know anything. And I was like, oh my gosh, the student's going to show up and they're going to ask me questions and I'm not going to know the answer to these things. But, as I started precepting students, I realized they were super scared. They felt like they didn't know anything. I was so passionate about the care that I was providing to my patients that I got really excited when the student would say, oh my gosh, I really liked your approach of asking these history questions, or the way that you taught this, or whatever. And then, somebody mentioned, they're like, have you ever thought about teaching because you know so much and your approach is really good. So then that's when, I realized I was having an impact on that one student, during the precepting experience, but I really wanted to have a bigger impact. And so I ended up going back for my Doctor of Nursing practice degree. My transition to teaching, it was pretty smooth. I was fortunate in that I had one semester where I guest lectured. And then the following semester, I was teaching secondary to somebody else. And then the third semester, I was the primary teacher and she was my backup. That to me was invaluable because I was able to really kind of ease into the teaching role. That's not always everyone's experience. People kind of have to jump in 2 feet first. I was able to teach things that I was passionate about, pediatric wellness, for instance, was my first class that I taught. And so it was something that I could teach without being too nervous because it was something I did day in and day out. So I've been a faculty member now for about 11 years, and I teach mostly at the graduate level.
When the MSN program director job opened up at the University of Nevada, Las Vegas, Imelda jumped on the opportunity to switch coasts and further use the leadership skills she developed over the past decade.
Neither of my parents went to college. My mom finished 6th grade. My dad barely finished high school. And so just being able to work with students that, 1, look like me, 2, might come from similar backgrounds, was really a big draw to the University of Nevada, Las Vegas. Then they have the overall designation as a minority serving institution. And so that to me, really got to the core of me being a first generation college student. I think of nurses who have doctorates, Latinas make up less than 1%. And so knowing that I'm one of them and that, I can be there as a role model or as a resource to other students. And I understand where they're coming from. My first commencement at UNLV was really exciting. They have two different ceremonies. They have one for the pre-license or for undergraduate and then a graduate ceremony. I volunteered to be a marshal. Even though I was new to UNLV, the call came out and I just volunteered. And at my last institution, I just always thought the marshal was like a cool, like when you would go to graduation to see the person like carrying the banner, for the school. I just thought that was really neat. You are with the students, that are graduating that day. I didn't realize how much bigger of a ceremony it kind of seemed like here. And so when I saw just, the stadium and stuff like that, I was kind of like, oh, now I know what I volunteered for. But yeah, just being with the students and, again, being like part of something that's bigger, I think is really a cool thing to do. There were two of us as faculty, and so we had a little snafu where she carried the banner and I actually got to hood a student. So I had the flag and I saw the student and the other faculty member and I, were talking to her, and then we realized that generally the chair will hood the student. But there was an issue that was just unforeseen, and the chair couldn't be there. And so we both looked at each other and were like, well, somebody has to hood her. So she volunteered to carry the flag. I volunteered to hood her. And so I got to know the student a little bit more. She told me about her project, and she was just so excited. She had her entire family there. And so we went up on stage. They said her name. We were able to hood her. I mean, there were thousands of people there, I think. And there were all the students from the different graduate colleges, and then all their families were kind of in the arena up above. After the hooding of the student, I got to walk out with her and I got to kind of see the faculty that were there for the graduation ceremony. I got to see the MSN students that, had just finished as well. So being at a new school, I thought it was really, seeing that Sigma connection was important. And I saw the cords that people were wearing. Everyone funnels out and everyone's cheering everybody else on. And yeah, it's a really exciting time. It was a really nice experience to be there for her.
Your commanding officer in the Navy really changed the trajectory of your life with that one reflection exercise. Is this something you now use with your students?
Yeah, I actually do that quite a bit. And I get students all the time that say, I'm not sure what I want to be. And I have them reflect back on what gets them excited, because I'm a big believer that if you love your job, then it doesn't feel like you're going to a job every day. Like it's something that you can really enjoy.
Will you be volunteering for any roles at UNLV's next graduation? If they asked you to give a speech, what advice would you give to students?
I'm just really looking forward to, I guess, participating in a similar way in that, just being there for the students. And this time I plan to be one of the faculty along the sides that kind of are cheering and being the cheerleader for them as they're walking out. And so I'm really looking forward to, seeing the students walk across the stage. So there they get a stole and they get their pins. Seeing the diversity walk across the stage, know that, again, we're adding to what's needed out there in the nursing profession. So if I were to be at graduation and giving the speech, I would say, always follow your passion. Always, remember why you got into being, a nurse. Don't forget the power that you hold, especially knowing that we're the most trusted profession out there. We are able to influence in such ways. Just make sure that you recognize the power that you hold and that you go out and do great things.
Thank you for listening to A Nurse First from Sigma. If you loved this episode, do us a favor and subscribe, rate, and leave us a review. It is very much appreciated. For more information about A Nurse First and Sigma, visit sigmanursing.org. Until next time.